Dr. Reem Sharaiha joins us now to talk about her study, which compares several different treatment options for obesity. Tell us a little bit about your study.
Thank you very much for having me here today. So the background of this study is that there are many surgical options for obesity that are proven time and time again to be very effective. But for the low BMI category, the 30 to 40, and roughly there are about 90 million in the US, there's no real effective treatment option for them. Surgery is not readily available and not covered by insurance. And even those who have surgery as an option, only 2% undergo surgery each year. So you're left with this treatment gap. And so we at Weill Cornell have been doing a lot of endoscopic gastroplasty, so an endoscopic sleeve, which is an incisionless procedure done through an endoscope in the stomach where you bring the stomach together. Kind of to copy the surgical sleeve out there, but it basically reduces the gastric volume and causes you to eat less, and has good results so far. So we wanted to compare this in the armamentarium of obesity and see where it would fit in. So we compared our endoscopic sleeve patients with the Laparoscopic Sleeve Gastrectomy group and the Laparoscopic banding group, and that's the premise of this study.
And so what were the success rates that you found?
So the success rates are kind of what we already know, but it was good to sort of find them in this study as well. So the surgical sleeve gastrectomy group did the best. They had 30% total body weight loss at the 1-year mark. We, however, did a little bit better than the lap band group. So we had an 18% total body weight loss as compared to the lap band, which had roughly 14% total body weight loss. So having that in mind, when you look at the lower BMI category, so BMI less than 40, our results were comparable to surgery, which is a good thing out there, sort of to say that really for those people who don't have that option, endoscopic sleeve is kind of out there to help you. In addition, we looked at the length of stay and adverse events, and for both those, the endoscopic sleeve had significantly less adverse events and significantly lower length of stay than the surgical counterparts.
And is it my understanding that it's less expensive for the patients as well?
It is less expensive, but the caveat is sometimes at the moment insurances don't pay for it, or they pay for a very small proportion. So we didn't really look at the cost in that way, but cost per patient in terms of length of stay and hospital admissions and OR versus endoscopic time, it's definitely less costly.
Good news for everyone, really,
Absolutely,
right?
Yeah.
But you're not necessarily recommending this for everyone. You said a small percentage.
Exactly. So, I mean, the key take-home points from this study are two. For those people who are eligible for surgery, a BMI greater than 40, especially those who have comorbidities, surgery should be offered to them, and they really should think about surgery as a good alternative for them. And the weight loss is amazing with that. You know, it's 30%. You're not going to get any better. But for those who surgery isn't available for them, the 30 to 40 BMI, then this endoscopic sleeve is definitely an option.
And what else do clinicians need to know about this?
So they need to know it's a day procedure. Patients come in and leave on the same day. Very low adverse event rate, and patients are pretty happy. They probably hate me that first day when they have like a little bit of nausea and pain, but over the long run, they're very satisfied.
All right, Dr. Reem Sharaiha, thanks for sharing your study with us.
Thank you for having me.